Again, I'll repeat this here myself, that all this exercise which I show in the videos on YouTube channel cannot replace the actual treatment. It's always advisable to take and professional help. Use a customized exercise program that's catered and based on your assessment only. That will help you out to achieve optimum results and not wrong outcomes. Hello friends, how are you doing? Welcome to my YouTube channel HealthQ, the place where my mission is to motivate you to look at the brighter side of the health. In today's video, I'm going to react to my most watched video on YouTube channel, and that is 21 exercises for Bell's palsy. I know pretty much people follow this video to do the exercises for the Bell's palsy problem, but I find this video a bit problematic. And that's why I want you to share my insights about this video and tell you what are my personal thoughts or else personal preferences on prescribing individual exercises which I've shared in this video to you basis different stages of Bell's palsy. So if you are excited to know this, make sure to watch this video till the end. Let's go ahead and see what are these 21 exercises. Exercise number 1 is raising your eyebrows like this. Now, for a person who is suffering from facial paralysis, you might find it difficult to move or raise your eyebrows from the affected side. So, in order to facilitate the movement, you can take the help of your finger and then do the same movement. Okay, so if I have to explain the same exercise to you right now, what I would suggest is, instead of using one hand, use both the hands. Place it on your forehead like this and then try to passively do it on the affected side, which means on your affected side you are not going to use any power, you're just going to support your hand, and then on the other side like this, and then you're going to raise your hand like this and then down. 1, 2, 3, 4, 5. Now if you are in subacute stage, or else you can say you are in the weakness stage where you have kind of partially recovered, at that time you can do the same exercise with 50% of effort of yourself and 50% of effort from your hand. Something like this. 1, 2, 3, 4 and 5. Perfect. Now let's move on to the next exercise. So, if you are having difficulty in doing this movement from the affected side, what you can do is just take the help of your finger and assist your this side, the affected side, to do the frowning movement like this. Okay, so for the frowning also the same principles apply. You can use both the hand on both the side. If you are in early phase of Bell's palsy, just give a passive support and do this exercise passively without moving your own self. To feel how the movement feel like, you can just try doing on your normal side first and then do it passively on the affected side. 1, 2, 3, 4 and 5. Perfect. Don't try to overdo it. If you are in weakness stage where you have partially gained the movement, at that time you can do active assisted, which means 50% of effort from your hand, 50% of effort from your affected side, and then try to perform the movement. 1, 2, 3, 4, 5, like that. Let's move on to the next exercise. Exercise number 3 is flaring your nose. If you have difficulty in... Again, flaring of nose is not easy on the affected side, and if you are trying to do it actively also, you won't be able to do it. So now if you want to perform flaring movement on your affected side, the way you're going to do is take the hand, place it around the nose and like this. Now when you're breathing in, pull the nostril outwards with the help of your hand and then breathe out. Breathe in, breathe out, breathe in, breathe out. So you are just trying to match the movement in order to feel how the movement feels like on the normal side and then on the affected side. Moving to the next exercise. Number 4 is smiling. Now, for a patient suffering from facial paralysis, again the smiling from the affected side would be difficult, and hence the assistance from the finger is required. So how to do that? Let's see. Again, for the smiling movement, here the affected side you won't be able to smile, so you need to give some extra push to finish your smiling movement. So you can take the help of forefinger, dig your fingers on your side and then keep it on the normal side as well. And then try to just finish the smile and give a push, upward push with the help of hand. Like this. Remember, you're going to do the smiling in a passive way. If you are in the weakness stage, at that time you can give 50% of effort of yourself and 50% of effort from your hand, and then finish the movement. Like this. Moving. Exercise number 5 is to open and shut your jaw. Okay, so open and shutting the jaw. This has no direct link with your facial paralysis because here you are doing jaw movements, and masseter muscle, which is mostly involved, is a muscle which is not supplied by 7th cranial nerve. So why we need to do this exercise? So the reason we need to do this exercise is because mostly when your chewing ability is impaired, or else your ability to eat food on the affected side is impaired, you tend to develop TM joint stiffness. This stiffness can impact or cause problems in future. So in order to prevent that, you need to make sure that your TM joint is moving on a regular basis. So doing a very harsh or wide opening movement might be difficult. So to make this more simpler, what you can do is keep two hands on the side of your TM joint and then slowly open your mouth and then close. Mouth, close. Like this. Simple. Don't overdo this movement again, only do it for 5 repetitions. Let's move on to the next. Exercise number 6 is to move your jaw from side to side. Again, jaw movements from side to side is also meant for the same purpose, to prevent stiffness from your TM joint. Because mostly I've seen people who suffer from facial paralysis for a long time develop some sort of TM joint weakness, which has to be prevented and avoided. So in order to do that, you just need to keep two hands on side and then just try to move your jaw side to side. That's it. No more than 5 repetitions here again. Exercise number 7 is to move your lips forward for spelling oo and backward for spelling e. Now, this is important. Saying oo and e, that too forcefully, is not advisable in initial phase of Bell's palsy. If you still want to practice this, start only when you are in the weakness stage, where you have regained some sort of movement. So at that time also avoid doing harsh movement like oo and e. Instead of that, say o, e, o, e, o, e, and prefer giving and support on your cheek while doing this exercise. Try to feel the contraction. If you're not able to feel the contraction, you can keep both the hands and feel the difference, how this side feels less mobile, and give that support to finish the movement like that. Let's move on to the next exercise. Exercise number 8 is to pull back each side of the mouth. Now, pulling back each side of the mouth, the 8th exercise, is again something which I would like to define a more bit about. So this is a lip rolling movement like this. Now this also gets impaired in Bell's palsy because of paralysis of your oris as well as other facial muscles. So in order to complete this movement, you might require the help of your hand. So take your help of your hand and just then try to roll your lips and then open. Again, I would tell that please don't attempt this exercise if you are in early phase of Bell's palsy. Only do it once you are out of the early phase or a slight movement started coming back on your face. Now exercise number 9 was bouncing the spoon between the lips. Number 9, we need a spoon. We need to hold the spoon between both the lips like this, and then we need to bounce the spoon. Again, this is a lip rolling exercise where in initial phase of Bell's palsy you might find it difficult. So don't attempt this exercise. This exercise is something which you can do once you have recovered from Bell's palsy and now you are in the strengthening phase where you are trying to strengthen your weak muscles and you are out of the danger of developing synkinesis. So maybe say if your Bell's palsy has recovered, It's been more than 3 months for you to recover from Bell's palsy, and you still feel some sort of weakness or something lacking on the affected side. At that time, this exercise is good to do, but not in the early phase. Is to blow the air from the mouth. Now, the next exercise, the blowing in air in mouth again. This is not advisable for someone who is suffering from Bell's palsy in the initial days, as it increases the risk for development of synkinesis, as this is a mass movement. We have to avoid doing mass movement as much as possible in initial days. Even if you are in weakness stage, don't attempt blowing movement. In weakness stage, even though what you can do is you can do gentle blows like this, but no, that is absolutely not advisable. Exercise number 10 is to blow the air from the mouth. So first we need to fill the air in the mouth like this and then blow the air. Weakness stage, what you can instead do is you can fill air, very gentle air in the mouth, because definitely the air will come out from the weak side, so we don't want that. So you can just keep pressure like this and then just try to fill air in the front lips. And then blow. Again, as you can see, I'm just doing a very gentle movement, and in order to blow like whistling, then you can take help of your finger and then do it like that. Next exercise, what I said was again ah, oo, and e. Exercise number 11 is to say ah, oo, e. This is an exercise which is again to be done in the late phase of Bell's palsy, where you have recovered and you are focusing on strengthening of your muscles, where your muscle power is improved tremendously. They are not zero. At that time, this exercise would be helpful, but not in the initial days where you are in complete paralysis or is in a very weak state. Okay, so the 13th exercise was pushing the lip outside to the spoon. Now this is to develop symmetry on your mouth like this. So if you want to do this, you can again do in the initial phase of Bell's palsy. And then you can gradually progress when you are in weakness stage to do just lip outward movement. And then in the later stages, there you can keep a finger and then try to push. And try to maintain this. But this is again in a very late stage. It is not advisable for the initial days. Now the next exercise of touching the lip to the soft palate and then bottom of the tongue. Instead of that, what you can do is, this is a good exercise again in the late stages, but in the initial phase you might find it difficult, your face would be deviated. Just try to move around your tongue. Just try to move around your tongue in the lower lip and then in the upper lip. This exercise which I've shown in this video can be started in the weakness phase. Exercise number 15 is to touch the tip of the tongue to the bottom of the teeth. Touching the tip of the tongue to bottom of the teeth was basically meant for people who are suffering from stroke related facial paralysis. For them it would be helpful, but if you're suffering from Bell's palsy, this exercise is not that helpful. So if you want to skip, you can skip absolutely, because this video I meant keeping every kind of facial paralysis patient in mind. And that's Number 16 is to touch again the tip of the tongue to the corner of the mouth like this. 16th exercise, touch the tip of the tongue to corner of the mouth. This is a good exercise to start off in the early phase of Bell's palsy itself. You can practice doing this like this to allow development of mouth closure in a proper way, and also to feel the lifting movement. Because your mouth is drooped, what you can do is you can lift your mouth, or it's the corner of the mouth upwards with the help of your tongue. This would be helpful. Exercise number 17 is to rotate the tip of the tongue to the cheeks. Now, 17th exercise, I asked to rotate the tip of the tongue to corner of your mouth, like this. This is a good thing to do in the weakness phase. In initial phase of Bell's palsy, you might find it a bit difficult. So in order to do this same movement, take the help of your finger and then rotate it. And then anti-clockwise. But don't attempt to do the movement with the help of your tongue in the initial phase. Exercise number 18 is to clench the teeth strongly, something like this. This exercise I won't recommend to anyone anymore. This exercise can be a good exercise for people who are working on strengthening and toning their muscles, who have completely recovered from facial palsy, and who want to just improve the tone of entire face. For them, it is a good exercise, but no, not in the early phase, absolutely contraindicated. Please don't do it. Exercise number 19 is to make a big yawn. 19th exercise was to make a big yawn. Now, I would suggest when you are doing this, don't try to do it as an exercise when you normally naturally yawn. Just try to keep your eyes as wide open as possible in order to prevent synkinesis, because we have the tendency when we yawn loudly, we try to close the eyes, which is a very common mass movement in synkinesis. So if you are doing a yawning practice, instead of closing the eyes, try to look upwards. Like this. Exercise number 20 is to make a big R sound, something like this. Exercise was to make a big R sound. Again, this is a very good exercise for synkinesis management, because when we say some words, your eyes get smaller. So only thing that you should do when you do this is and then try to look upwards and outwards, something like this. But please don't attempt this exercise again in the initial phase of Bell's palsy. Only do this after you are out of it, you have started developing movements and contraction on your facial muscles. And the last exercise was pulling the lower lips downwards. Again, this is an exercise which is basically used to train synkinesis patients, where we have to control and focus on individual movements. So please don't attempt this exercise again in the initial phase of Bell's palsy. Attempt it in the later on stages, but again, when you do this, make sure that your eyes are wide open, like this. But please, again, don't do it in the early phase of Bell's palsy. Again, I'll repeat this here myself, that all this exercise which I show in the videos on YouTube channel cannot replace the actual treatment. It's always advisable to take and professional help. Use a customized exercise program that's catered and based on your assessment only. That will help you out to achieve optimum results and not wrong outcomes. I hope through this video I could clear out a lot of doubts that you had related to your facial exercises during Bell's palsy. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.